So this is 135 eye of the tiger sign. This is the picture of this is a T2 weighted image which shows that there is basically symmetrical bilateral hypointensity which is usually more likely due to iron accumulation in the basal ganglia, and in between it's surrounded by hyperintensity on both sides, likely due to gliosis and spongiosis. This is a typical picture of eye of tiger sign which can be seen in patients. I'll talk about this now. So as I've told you, it's symmetrical bilateral abnormal low signal on T2 weighted MRI, which is due to accumulation of iron in the basal ganglia globus pallidus, with central high signal, which you can see here. This one, central high signal in both sides with due to gliosis or spongiosis. This is classically associated with pantothenate kinase associated neurodegeneration. PCAN, formerly known as Halvard-Warden-Spatz disease. It was first described in 1922. It is an autosomal recessive neurodegenerative disorder associated with accumulation of iron in the basal ganglia. There are two major forms. One is the early onset, which is in the children, and it is a classic onset, and late onset, which can occur after 20 in the adulthood as well. The early onset, classic onset, is rapidly progressive and characterized by gait impairment, along with dystonia later, which develops, leading to loss of ambulation, and it can also cause intellectual impairment. Retinitis pigmentosa and optic atrophy are also associated with the early onset. The late onset, in contrast to classic one, is more likely with neuropsychiatric symptoms such as ADHD, obsessive compulsive disorder, depression, and schizophrenia, but later on can develop Parkinsonian signs with dementia as well. So this is another flare image which shows the eye of a tiger sign. You can see characteristically there the findings. MRI is the first line exam and should include iron sensitive sequences, which include SWI, GRI, T2, and contrast to demonstrate the characteristic iron deposit in the globus pallidus. Differentials can include Wilson's disease, multiple systemic atrophy, neuroferritinopathies, progressive supranuclear palsies, and mitochondrial membrane associated neurodegeneration. Other diseases such as levodopa sensitive Parkinsonism can also present like this, and along with that, cortical basal degeneration. So, neurodegenerative disease with accumulation of iron is also PANC. Treatment is usually, there's only supportive treatment available for pantothenate kinase mutation. Usually, people have some residual activity of pantothenate kinase enzymes, but that is not beneficial. Iron chelation is not effective, but in America, in FDA has approved deferoprone, which is an iron chelator, and that can sometimes help. Levodopa and anticholinergics are beneficial for Parkinsonism signs, and baclofen for the spasticity. In severe cases, you can do DBS. Learning points overall, pantothenate kinase mutation is a clinical diagnosis that should be pursued if characteristic abnormalities are seen on the MRI. Young patients with dementia, Parkinsonism should be screened for PANC2 mutation if no other explanation for these symptoms can be found. Thank you.